Hi, I'm Doug Llewellyn. Both William Shatner and I are proud to bring you this most important series that focuses on the impact that entrepreneurs are making on our nation and our lives. You know, part of keeping the heart of America strong lies in helping Americans to be strong and healthy, but that's not always easy. With all the health problems that exist in today's stressful world, millions of Americans suffer from such things as neck and back pain, carpal tunnel syndrome, sciatica, headaches, bruises, tendonitis, numbness and tingling, disc problems, sports injuries, auto injuries, and on and on and on. Question is, what can be done about all of this? Well, our guest today devotes her life to healing that and a lot more. Her special services include chiropractic, physical medicine, nutrition, acupuncture, rehabilitation, and massage. And that's a pretty tall order, and we're about to find out how she goes about fulfilling it. Our guest is the president of a clinic known as Total Chiropractic Care, specializing in sports medicine and family care, and it is located in Sugar Land, Texas, near the great city of Houston. Her name is Dr. Yvette Nadeau. Dr. Nadeau, welcome. Nice to have you here.
Thank you, Doug.
Let me ask you, first off, what are the main problems? I know we just ticked off so many of them, but the main ones that finally prompt people to come see a chiropractor?
A lot of headache patients that we see, back problems.
Yep.
Basically herniated discs with back problems, and just a whole string of sports injuries.
You know, what's amazing is we just listed a lot of things that you really do treat. It seems like you treat more than what I would assume a normal chiropractor would treat. Maybe it shows you my limited knowledge of the practice of chiropractic.
Actually, Doug, you're correct about that. Most chiropractors don't expand so much into different services, and we tend to expand a little more than others, basically to treat the whole body, not just one part of the body, and so we have a complete services.
I mean, for example, acupuncture, do you do that?
Yes.
Does the average chiropractor do that?
No. Basically, this is all postgraduate education that you can get after graduating from chiropractic college. The same thing with the nutrition. It's a diplomate series that you can obtain. That's a 2-year program. The sports chiropractic is also another year of certification. All of this is attained afterwards, after you're already a doctor of chiropractic.
Let's go through some of these things and just explain to me, you know, what you do. Number one, you just mentioned sports chiropractic. All right, I think it's self-evident, but tell me what that entails.
Okay, well, sports chiropractic is a little different than you would see in a sports medicine area. In sports chiropractic, we're going to look at the body and how the body can heal itself. Instead of looking at the symptom, we're going to go after the cause. So we're going to look at the biomechanics of the body and basically relate where the problem is. We're going to actually, a lot of times it's a muscle that's off of somewhere else. Right. So a lot of patients are saying, well, doc, why are you working on this when my pain is over here? And I say, well, give me a little bit and you're going to notice that everything's going to go away a lot quicker than you're used to. It's not going to take the 4 to 6 weeks or just basically telling you to rest and ice it. It's going to go away a lot quicker because we're going to go after the cause. So just like there's problems at iliotibial band syndrome that we treat with runners, they call me iliotibial band queen because they can't believe that I can treat it so quick. They can get back out there and run. We treat a lot of marathon runners. They're amazed on how quick they can actually get back out there.
How long does it take?
Normally somebody would say, 4 to 6 weeks because it's the inflammation that they're concentrating on. They're concentrating on where the symptom is, where the band actually connects and connects at the knee, and that's the symptom. So we're going to go after the cause. We're going to find out, well, why do they have IT band syndrome, and is it coming from the gluteus max? Is it coming from the tensor fasciae lata muscle? There's a lot of different other muscles that are incorporated to have a situation, and that's what we're going to go after. We're going to find out what is actually happening here and why did they get that, because we don't want them to have a reoccurrence. We can treat it really quick, and that's the easy part, but we're going to stop it so it doesn't keep reoccurring. So instead of 4 to 6 weeks, what might be a situation? Basically, typical treatment time is about 6 to 7 treatment.
Therapeutic massage, that's one of the things you do.
Right, I have a massage therapist that does that. She'll do Swedish massage, therapeutic massage, medical massage, and that's more incorporated to what we do. We do a lot of different soft tissue techniques. Those are things, again, people can't see, so they're very amazed when they start seeing their body healing, and they just think it's a miracle. They keep saying, this is a miracle, this is a miracle. To me, it's physiological. I understand the body, I understand anatomy, I understand physiology, so to me it's very simple to put it all together.
It's pretty obvious. You really know what you're talking about. Let me ask you something. Suppose somebody doesn't have any kind of symptom at all. Does it pay to come see someone like you? I mean, does it help?
It does, because most people they chase a symptom and they don't understand that the cause is there a lot sooner before the symptom. The symptom's the last thing that appears. That's why the symptom's going to be the first thing that disappears. So basically, it's like a chain reaction. They basically have something, their body's going to compensate, and it keeps going over to this line. Well, they come into my office when they're right here, but what I have to do is go back and reverse, like putting a videotape and rewind. And that's basically the mechanism I'm doing. If they come in the initial phase, it's even quicker because we're catching it before it went into a whole compensation mechanism. So basically just evaluating the body, see what their gait is. We put them on the treadmill. There's other different things that we do. We also have a computerized muscle tester. Everything in our office is very scientific. So we can see numbers, and we like to analyze everything. And that's the reason we tend to treat a lot more people that like to see that.
I mean, it's interesting the things that you mentioned that you do treat, I think the normal person wouldn't think of going to a chiropractor to treat a headache. But you do that.
Yes, we do. Because a lot of times the headaches are, again, they come from tension. We have to find out what is the reason. Do they have migraines? Is it a chemical reaction? If it's going to be chemical, I'm going to look at nutrition. There's going to be acupuncture. We use acupuncture for an array of things from A to Z, digestive disorders, and headaches, tension.
Do you do anything to help somebody who suffers from, like, arthritis?
Yes. There's different forms of arthritis. One of my hospital rotations I did do was in the VA hospital, and basically there's rheumatoid arthritis, there's osteoarthritis. So there's different kinds of arthritis. Now, when somebody has rheumatoid arthritis, there's not much we can do on that. That's going to be a disease process. It's an autoimmune. It's basically just calming it down, using anti-inflammatories. Again, we're going to go towards more of a supplemental usage and dietary factors. So we're going to tell them basically increase their flaxseed, different things that we can include in their diet and help them. The osteoarthritis is more of a wear and tear. It's a repetitive motion. Glucosamine sulfate works wonders for helping with osteoarthritis. Basically, anybody can get that. People that work on the computers all the time, they can just anything that's repetitive. You can get it in your spine, degenerative processes, and that's what chiropractors help with by mobilizing the joints. What we're causing is a natural response that the body is actually supposed to do. The spine is housed in between the vertebral bodies, and when the vertebral bodies are actually supposed to be moving, and that causes a cerebrospinal fluid to pump up and down from the sacrum to the occiput. Well, when things get fixated, because there's inflammation, the muscles get tight, they pull, and they get stuck in one position. That's a fixator or subluxation. What chiropractors do is we correct that. By correcting that, now we're allowing the normal flow of fluid to go through those joints because we're supposed to move. If we weren't supposed to move, we'd walk around just straight out. But we're supposed to move. Our joints are supposed to keep mobile, and that's the same thing as your car. You have oil that's supposed to be clean oil, and that's what we're doing with the joints. We're basically having the synovial fluid, the clean going in, the bad stuff going out, the bad toxins going out. You flush them out, drink water, and that's what's happening. We do a lot of forms of soft tissue work, myofascial release, using tools which are called Graston, a lot of different things to get out adhesions, scar tissue. When people have rotator cuff problems, we can actually prevent them from having surgery.
Let me get back to some of these other things that you do. What medical nutrition? You just referred to that.
Yes.
You do balance what someone eats with.
Exactly.
Because you think it plays a role.
It plays a huge role. If we basically always go externally and constantly go externally, well, the treatments are going to take a lot longer. That's the reason why we're so successful in our clinic, and we have a huge referral basis, is because I do get patients better very, very fast because of the different tools and different services that we offer. And one of them is using nutrition.
So do you put them on a diet of some sort, or are these medical supplements or nutritional supplements that they take?
We use nutraceutical products, but that's only usually to jumpstart the system. But how we're testing it is using laboratory test. Just like a regular CBC that a medical doctor would provide, we're going to get the same test, a CBC, a lipid panel. We want to see glucose to see, basically what their glucose elevation is. We're going to see the same test, and there's also intracellular tests that we use, but they're blood work tests, so everything's more scientifically rather than just an opinion of what I think versus on something.
And then, instead of medical nutrition, you do physical medicine.
Right. Physical medicine is using different modalities. Electrical muscle stem, ultrasound. We use laser, and that's for calming down the inflammation. So we use an array of different modalities. The decompression table is also considered as physical medicine, using different things extending past my hands.
Well, I must tell you, I'm learning a lot here, and I assume you are too. This is pretty fascinating. Our guest is definitely fascinating. Again, this is Dr. Yvette Nadeau. She is the president of the Total Chiropractic Care Clinic in Sugar Land, Texas, which again is near Houston.